Good morning, everyone. The first slide was who I am, but more important is what I am. This is the quote given by my mom and dad when I was very small child. How happy is he born and taught, who serveth not another's will, whose armor is his honest thought, and truthfulness is utmost skill. And I try to and strive to live by that. This is where I work, Nottingham University Hospitals. The only thing besides everything else is famous is that it has got 28 miles of corridors and you can run a marathon inside the hospital, period. This is my journey for which I'll be talking, and I won't say I took this journey out of strength. Most of them was out of necessity, out of, whatever you call it. Except US, I go and I come at my own will. So I do have conflict of interest. Of course, I worked here till the age of 32. I used to be assistant professor in PGI Chandigarh, and I still am an OCI, Overseas Citizen of India. Of course, I'm a British citizen for the last 24 years, and I do have a permanent resident status in the United States, so I belong to three, and there will be some bias, and I'm declaring that conflict. So what am I going to tell? I'll be talking about teaching and training, especially in the three continents. Then I'll be talking about how the feedback differs in the three places. I'm not going to talk about the five, and I'll come to that. Then I'll talk about the leadership, how it differs in the all three places, which I will be coming. And then my advice to the trainees and the young faculty, take it, leave it, I just have to say. So these are the three systems I'll be talking today, comparing Australia, United States of America, and UK. I won't talk about India because I left in 1994. I don't know how things are happening, so I will be very bad to say anything. And of course, I only work for 6 months and they don't have a teaching and training program. I can say that. So this is when I came to UK in 1994 and I left in 1998 for Kuwait and Australia. We used to have a very good training system. I must say even at par with America or anywhere else. And then came this thing called EWTD. And those of you who don't know, this is called European Wide Time Directed. And I call it European Wide Training Decline. So we brought this 48 hours, we have a Brexit, we didn't change it. So this is my main slide which I want to talk. If you look at this slide, if you look at the USA, this was my visit to Boston Children's in 2009 and 10 when I was a pediatric urologist in DC. So Dr. Kurt Newman arranged it. And I was stunned. There were 24 attendings. There were actually 23. 24 consultants and 2 regional fellows, means local fellows. Rest the rota, 1 in 5 was done by the overseas trainees. And these 24 or 23 are doing the jobs which, in my own experience in UK and Australia, the trainees do. But here the consultants or the attendings are doing. So that is the difference, and you can read the slide later on, I won't go into details, but that sums up why they are producing much better trainees or much better surgeons, because they have quantity and quality. They have got flying hours, which we talked about that, but there is a quality also, double Q. And that is why in US, they call them faculty. In England and Australia, we call them consultants. Faculty means your job is to teach, period. That's it. And I learned in US for 3.5 years how to operate from the left side. I have yet to see any attending surgeon in my 3.5 years in the US who is standing on the right side to begin at the operation. He may take over later on, but always it starts with you being on the left side. And that is a culture shift. And culture is very important. And the other thing which I learned is that I worked there for 2.5 years, I was chief. I mean, every PGY, means first year surgery resident, knows how to cross clamp a aorta through the left side of the chest. Sorry, I'm going other way around. And because he learns that on a perfused cadaver model, period. It costs something like $500,000 to run. So you got a cadaver, there's a blood and there's a cardiopulmonary bypass, and every person knows. My chief resident calls me in the night, year 5. Sir, what should I do with the 5 bullet holes in the abdomen? I said, you know what to do. Yes, yes, sir. Are you comfortable doing or should I come and do it? I'm okay. So the clamp is done, tap is closed. I have only to sort out the venous bleeding below the diaphragm. So that is there. And 2, your reward is different. I mean, I've never been trained in America. I did 0 fellowship, 0 training. And here, I'm the best teacher on year 1 because the trainees pick 60 or 80 residents picks the best teacher, not the director. And you get a good reward, and it's the trainees. I mean, on this function, the dean is there, the vice chancellor of the university is there, but the award is given to me by the trainees. So that is something. Feedback, yes, I need to talk. I mean, I learned it first from my daughter who worked in McKinsey. I mean, I learned it in my MBA, but that's where I came. Because she says that even if she's working with the ex-president of the Mexico and she's the bottom of the food chain, at the end of the project, they ask each other feedback. And if it doesn't hurt each other, you haven't given a true feedback. And that is something which I'm not going to go into that. But basically, this feedback science is this. There are certain facts about you which I can see, but you don't know, and I have to tell you. That's feedback. I mean, it's one of the windows of Johari's windows, or what we call blind spot. In motor terms, I don't need to spend time here. Fine? But this is what I learned in the Western world, not here. Maybe it is there now, I'm not saying this. I mean, which we call, the sandwich model of the feedback. So, what is the sandwich model? You give a warm-up, somebody comes, you say good things about that. Then you tell what they ought to hear, not what they want to hear. Straight. And then you soften it if you said too much. Fine? That's called sandwich. So what is the difference I saw? They're too polite. And I say sometimes to the extent, you can be a bit dishonest. You're not doing them a favor. Because the middle part is missing. It's almost none. I went to Australia, yeah, it was there. But here, you hear what you ought to hear. Of course, it's not very blunt, but I think this is very important. Because, as they say in the business school, if it doesn't pinches, you didn't get it. Then coming to leadership, I'm not going to talk about that. Okay? I'm just going to talk about how I learned from US how to select, whom to select, and whom to develop and whom to promote. I think they are the best, if you ask me. I mean, I worked in England, I worked in Australia, I don't find it like that. Residency, you all know, I'm not going to talk about that. You know the matching system. I don't think any other nation does the national matching system where the resident scores you, you score the resident, and then there's a national match. I'm sure all will agree with me. If not, we need to disagree. Leadership, oh my goodness, the chief resident, because I was in West Virginia and that was a big surgical residency program. There are 60 residents, there are 80 faculties. I tell you, when it comes to the chief resident, everyone's photograph is put as if you are discussing a terrorist and you are an FBI. All these 5 chief residents who are about to become, we discuss them, we debate them, and we listen to the minority, but majority will prevail. But there's a robust discussion because we can't get it wrong. Because this person is going to be the leader of 60 or 70. So we have to get it right because everyone knows who's the idiot and who's not good. Like in army analogy. You can't reward a wrong person. You may miss the right person, but you can't reward a wrong person. Faculty, I only realized when I go to US that you have 3 days dinner, lunch, and breakfast, and you meet 40 people and they call it interview. I think that's the best way, if you ask me. Nobody else interviews like that, not to my knowledge. Because this teases the behavior versus personality. And when I used to interview, I used to quote Warren Buffett. He says, first I look at integrity, that's missing, I just stop the interview. I don't care, nothing more. Then comes the passion. Last comes the ability. I can teach anyone, but I can't bring the ability or integrity. I can't bring the passion. If it's missing, especially integrity, I forget about working on all those. I mean, that's another thing I learned in my US, in my limited experience of 3.5 years. I won't say 24 years, but in UK, I mean, I'm an MBA, I can become a chief, but that's not essential. But in US, I have hardly seen anyone who's on a top position and he's either an MBA or he's been to Harvard, Stanford, Wharton, Yale, or you name it, I mean, I'm not taking all the business schools, I don't get shares from these business schools, But what I'm saying is they have done something. I'm not saying that they'll make them leaders, but it polishes if you already have skills. If you're, whatever the personality, I'm not going to use the name, but MBA is not going to change it. But if you already have those traits, it will just enhance it. So That's what I would say is the difference. So, last, what is my advice to the trainees and young faculties? Let's talk about the post-MCH who are sitting here. I don't see many, but I'm sure they will catch me in the lunchtime. Fine. What am I going to tell them? Do all USMLE, period. Fine. You can do 1 year fellowship or 2 year fellowship. And I'll tell you why. What's the difference? If you do 1 year, you can come back here. You will be a very mature surgeon. And if you do, I'm sure the America can absorb you. And I've seen plenty. And I can debate with any American or anyone who says that it doesn't happen because it happens. I mean, I could get my chief position without any fellowship. So you are doing a 2 years fellowship. So you will be better than me placed. And other good news is that USMLE step is pass only these days. It's not a percentile anymore. This is a recent change. I'm sure, sir, you will be able to. Step 2, you're not doing residency. Pass. That's it. What's difficult? I did it at the age of 34 and 50. So what is your problem? 50, 50. I completed my USMLE. I was already attending in Washington, D.C. So why can't you do it? And this will give you 1 year fellowship. You don't need step 3. If you do step 3, again, pass only, and you get 2 years fellowship because you go on what a visa called H1B. Now, I'm not here as a visa officer, but I'll tell you difference. This will give you J1, this will give you H1. H1 means you don't have to return to your home country and you get absorbed there. For faculty, my advice is again do this for a different reason. You can go for sabbaticals, you can go for a visiting, or you can do a 1 year fellowship. And that's it. I rest my case here. Period. Thank you.
Thank you, Shailendra, for very nice talk. So if I have to ask you a question, which country has the best training?
United States, period.
Okay. So what is the difference between India and United States training? The major difference?
Culture, because there the faculty means that no consultant or attending will operate. So that's number one, culture. Because as they say in business schools, culture eats strategy for lunch, dinner, and breakfast. You can bring any strategy, but if you don't have a culture, you're gone. And I still haven't understood where this American culture comes. But it is there consistent, and I've seen it over a period of 15 years. They teach. I have never seen them operating. And in England, oh yeah, 50% cases, consultants do. Why are you operating when you're already 20 years down the line as a consultant? Your job is to teach. So if you ask me one, that is there. So firstly, there's a quantity, but India also has a quantity. But I think main thing is this culture and quality.
I completely agree with you because when I worked there, 98% of the surgeries were done by fellows and residents. And I think in India also, a lot of surgeries are done by juniors, but that number has to increase. Any comments, suggestion, questions from my co-chairpersons?
No, sir, I think I completely agree with this. It has been there when I was in PGI. It continues to be here when I'm in AIMS Rishikesh, and there is so many years now between the two.